Hello and welcome to the Providence College Podcast. This week we wanted to present the first episode of Competing Diagnoses, a podcast series by students and faculty in the Department of Health Policy and Management addressing the healthcare industry here in the state of Rhode Island. Here is Dr. Robert Hackey, Professor of Health Policy and Management.
Welcome to Competing Diagnoses. Our podcast provides listeners with a fresh take on current health policy issues here in Rhode Island. Each episode features critical conversations about health politics and policy, informed by published research and interviews with policymakers, providers, payers, and scholars. Although we won't take sides, each episode will take a nonpartisan and evidence-based approach to educate listeners about health policy issues that affect all Rhode Islanders. I'm Bob Hackey, a professor of health policy and management at Providence College. I've been writing about state and national health policy issues for nearly 30 years. Over the past few months, I've assembled a dynamite team of student researchers to explore some of the state's most pressing health policy issues. Thanks for joining us today as we dig into the proposed merger between the state's two largest hospital systems, Lifespan and Care New England. This proposed merger, which was first announced last September, is one of the most significant developments in Rhode Island in the healthcare system in decades. Lifespan President and CEO Dr. Timothy Babineau hailed the proposal to create an integrated academic healthcare system in Rhode Island. He argued, "There are no losers here. There are only winners." Former Governor Gina Raimondo echoed this sentiment. She declared that there is no question that a local, integrated healthcare system is in the best interests of Rhode Islanders. And earlier this week, Lifespan and Care New England filed their merger application with the Rhode Island Department of Health and the Rhode Island Attorney General's Office. In the coming weeks, we'll explore the evidence for and against these claims. In particular, we'll dive into the long courtship between these two systems, examine arguments for and against consolidation in local hospital markets, and explore key issues that policymakers need to consider as they review the proposed merger. We'll also introduce you to the regulatory environment here in Rhode Island by focusing on the review process created by the Hospital Conversion Act and the role of the Office of the Health Insurance Commissioner. Finally, we'll consider how officials at the Federal Trade Commission may view the proposed merger. Julia Scheuring, a senior majoring in health policy and management and Spanish at Providence College, kicks off our conversation by placing the proposed merger, more than a decade in the making, into context.
Hi everyone, I'm Julia Scheuring. Today I wanted to help you understand the history of the merger between Care New England and Lifespan. Over the past decade, we've seen a surge in hospital mergers across the country. A 2020 report by the Kaiser Family Foundation noted that 778 hospital mergers occurred in the United States between 2010 and 2017. Roughly two-thirds of all the hospitals in the United States are now part of the health system. Now, the national debate about hospital mergers is playing out here in Rhode Island. To set the stage for this debate, let's look at the parties involved in the proposed merger. Lifespan's hospitals have more than 16,000 employees and 1,165 licensed beds. In 2020, Lifespan generated more than $2.5 billion in revenues. Lifespan includes 5 of the state's hospitals, including Rhode Island Hospital, the Miriam Hospital, Hasbro Children's Hospital, Bradley Hospital, and Newport Hospital. Rhode Island Hospital, Bradley Hospital, and Miriam Hospital serve as primary teaching hospitals for Brown University's Alpert Medical School. This week, Coastal Medical, the state's largest primary care physician group, also finalized an affiliation agreement to join the Lifespan system. Care New England was founded in 1996 and has about 8,000 employees. In 2020, Care New England generated $1.1 billion in revenues, making it roughly half the size of Lifespan. Its 3 hospitals include Women and Infants, a tertiary care facility that delivers over 75% of the babies born in Rhode Island, Butler Hospital, the state's adult psychiatric hospital, and Kent Hospital, a community hospital in Warwick. Both Butler and Women and Infants also serve as teaching sites for Brown University's School of Medicine. In April 2021, Brown University President Christina Paxson noted that right now, Care New England and Lifespan, compared to major healthcare systems around the country, they're both subscale, they're tiny, and bringing them together will actually create a healthcare system that is still on the small side. Brown is poised to play a leading role in shaping the future direction of an integrated academic health system. The university pledged to invest a minimum of $125 million over the next 5 years to support greater integration of clinical care, research, and quality improvement efforts. The new system will create a network of 8 hospitals with total revenues of more than $3.5 billion. Nearly all Rhode Islanders will be affected by this issue, as most individuals and families will access care at some point from one of the hospitals included in this merger. In addition, the new academic healthcare system will become the state's largest employer. The new entity will include a majority of the state's acute care hospitals and both of the state's inpatient psychiatric facilities. The merged system will control about 80% of all hospital beds in Rhode Island and more than 2/3, 68%, of the 2,440 staffed acute care beds in the Rhode Island hospital market. In short, the stakes of this proposed deal are high. A recent report by the Deloitte Center for Health Solutions predicted that hospital mergers and acquisitions will increase around the United States over the next decade because of declining hospital inpatient revenue and lower occupancy rates. The authors of the study expect that merger activity will be greater in areas, such as Rhode Island, where population growth is flat and hospitals have experienced poor financial performance. Next, my colleague Talia Quinn will review the history of this proposed merger.
Hi, I'm Talia Quinn, a junior at Providence College majoring in political science and health policy and management. The Lifespan Care New England merger has a long history. The two systems have had an on-again, off-again relationship for more than a decade. Care New England and Lifespan first explored the possibility of a merger in 2007, but it never passed the state's review process. The hospitals blamed the state regulators, and the regulators blamed the hospital for the failure. The CEO of Lifespan at the time, George Pachone, chalked up the failure to complete the merger to deal fatigue. State regulators, including the Attorney General at the time, Patrick Lynch, also had their hands full with another merger between Roger Williams Medical Center and Our Lady of Fatima Hospital that required approval from the Vatican. As a Catholic hospital, Fatima's merger with the secular institution required permission from church officials. After this initial setback, Care New England acquired Memorial Hospital of Rhode Island in Pawtucket in 2013. Although Memorial had struggled financially, Care New England hoped to expand its reach by focusing on primary care. At the time, Memorial housed the primary care residency program for the Brown University School of Medicine. After losing tens of millions of dollars over several years, Care New England was forced to shut down the hospital in October of 2017. Memorial recorded a massive financial loss of $68 million in 2016, threatening the fiscal stability of the entire system. In the wake of the closure, hundreds of workers lost jobs. Care New England still remained in a vulnerable position after years of trying to keep the failing hospital afloat. These financial pressures led Care New England to explore potential mergers in an effort to stabilize its precarious fiscal position. After conversations with Prime Healthcare failed to bear fruit, Partners Healthcare, now Mass General Brigham, sought to acquire Care New England in 2017. Partners Healthcare was, and still is, the largest hospital network in New England and has a dominant position in Massachusetts' healthcare market. Its Brigham Health Division signed an agreement to purchase Care New England in late spring of 2018. Lifespan and Brown University strongly opposed this move, warning that Partners would disrupt the Rhode Island healthcare market and undermine the financial health of local hospitals. Lifespan and many public officials, including Governor Gina Raimondo, urged Care New England to reconsider this plan. Brown University also argued against this acquisition and put their hat in the ring as a bidder, partnering with an out-of-state health system. Governor Raimondo, however, rejected the notion of an outside system entering the Rhode Island market and advocated for the creation of a unified, locally controlled academic health system. After Partners withdrew its bid to acquire Care New England, negotiations between Lifespan and Care New England resumed last year. In April of 2020, Fitch Ratings observed that the long-term prognosis of Care New England remains daunting, and noted that the system had a stressed balance sheet that limited its ability to undertake new capital projects. Fitch argued that the pandemic has brought on additional collaboration and new urgency to an on and off again discussion with Lifespan for a local solution for the long-term struggles faced by Rhode Island's two largest health systems. In September of 2020, both systems announced plans to partner with Brown University to form an integrated, locally controlled academic medical system. This past week, the parties filled their formal applications to merge with the Rhode Island Department of Health and Office of the Attorney General. Now, my colleague Lily Sanphy will provide an overview of how the Affordable Care Act influenced hospital mergers over the past decade.
Hi everyone, I'm Lily Sanphy and I'm a junior here at PC, majoring in health policy and management with a minor in business and innovation. I want to place the proposed merger into context by talking about how the Affordable Care Act, also known as the ACA, helped to transform healthcare markets over the past decade. The ACA provided strong initiatives for providers, including hospitals, to consolidate in order to achieve these new efficiencies. The ACA expanded health insurance coverage for millions of Americans by creating health insurance marketplaces and expanding Medicaid eligibility. The ACA coverage expansions, however, are financed in part by slowing the rate of increase in Medicare payment updates. This created an uncertainty for hospitals, as many formerly uninsured patients had unknown healthcare needs, which potentially increased the intensity of services required, and at the same time as federal officials promoted new ways of paying providers to promote value-based care. An article published in the Journal of Law, Medicine and Ethics in 2018 noted that, in a rising cost environment with the little ability to pass on enhanced cost due to the present reimbursement structure, scale became a dominant management strategy. As a result, the number of hospital mergers increased significantly over the past decade from 76 in 2010 to 115 in 2017. In addition, the political uncertainty surrounding the ACA also encouraged consolidation. Republican efforts to repeal and replace the law from 2012 to 2017 added further incentives for hospitals to seek this control in costs and improve their bargaining position. Mergers offer hospitals with a way to cope with an uncertain environment. Consolidation offers hospitals greater pricing powers in their negotiations with private payers and also enables hospitals to pursue efficiencies by sharing the costs of common services such as human resources, marketing, and contracting with these private vendors. In Rhode Island, the Office of the Health Insurance Commissioner, or OHIC, regulates the rate of increase for health insurance premiums. Nevertheless, concerns about hospitals' market power remain. The new academic health system will be such a large player in the Rhode Island health insurance market have to make a stronger bargaining position in contract negotiations with private insurers such as Blue Cross and Blue Shield of Rhode Island and United Healthcare. Now, a final word from my colleague Talia Quinn.
Thanks, Lily. All of us here at Competing Diagnosis want to thank you guys for listening to our first podcast episode. We hope you've learned more about who's involved in the proposed merger between Lifespan and Care New England and what it means for Rhode Island. We hope you'll join us for our next episode, where we'll explore lessons from the academic literature on the pros and cons of hospital mergers.
Thank you for listening to this episode of the Providence College Podcast. You can find the Competing Diagnoses podcast on Spotify and the links in the show notes. Please make sure to subscribe, rate, and review to the PC Podcast wherever you listen to podcasts.